When it comes to breast cancer, early detection is the key to better outcomes. It's also important to separate fact from fiction, especially when it comes to mammograms and breast health. You know, Trinity Health is part of the Cancer Network of West Michigan, which provides patients with access to advanced care and expert support every step of the way. And today we're joined by breast surgeon Dr. Jamie Caughran from Trinity Health to bust some of those myths surrounding breast cancer screenings. Good morning, Dr.
Hey, thanks for having me very much.
Absolutely. So breast cancer screenings happen. They're happening right now, every day, but some avoid them because of these myths. Let's bust some of these out. Let's say family history. Somebody might say, because we hear family history is a very big part of cancer. I don't have a family history, therefore I probably don't need a screening. That's a myth. That's
absolutely a myth. And actually what I say to my patients all the time is 85% of my cancer patients have no family history of breast cancer.
Stop right there. 85%. You hear so much that family history is such a big key. The majority of cases you're seeing have no family history.
Exactly, and that's why we screen the whole population every year, because we want to catch people that we wouldn't have expected to grow cancer.
Absolutely. Now, some people say, but that test exposes me to dangerous radiation.
Yes. The amount of radiation in a mammogram, a screening mammogram, is very low. It's less than an airplane flight. So I have patients that are flying all the time and don't worry about that type of radiation. And this is one that could really save your life.
Absolutely. So if you think about that, you're going through the airport. That radiation that you're going through there is stronger than what you're going to get in a mammogram. So what if you don't feel a lump? There's the self-exams that women go through trying to feel for a lump. No lump, no need for a mammogram. That's a myth.
Oh, absolutely a myth. So usually when we feel something in the breast, it's about 2 centimeters big. So most cancers that we want to detect are going to be tiny and microscopic. So the earlier we can find something, the less treatment you're going to need most of the time. So certainly catching something before you can feel it is ideal if it's going to happen.
Yeah, that's the key point there, to be able to catch it before you feel that lump.
Exactly.
Because we're talking microscopic when it comes to these, we're talking cancerous cells here. So what if they just got a clear one? My last mammogram was clear, so obviously maybe I don't need another one.
We love to be reassured by that, and the history of having a bunch of normal mammograms is great, but there are cancers that develop intervally, and sometimes even if a mammogram is normal and you're feeling something, we still want to see you back for a diagnostic exam and probably an ultrasound to troubleshoot an area that you might be feeling. So
this is obviously important. So we're busting through all these myths, all these excuses, and you've heard all of these.
I hear all day long. I get it.
I'm not telling anything you haven't already heard before, and I'm sure one of them you'll hear is the pain. There's some pressure here, okay, some discomfort, and some people say, well, it's just too painful to be worth it, which to me sounds a little silly to say.
Yeah, it's not anything really anyone looks forward to doing. Sure, but what I will say is our technicians are so great in the mammogram department, and they can get you in the most comfortable position as possible. They're very good at being specific with their instructions to make that mammogram experience go as smoothly as possible for our patients.
And of course, the whole part of that rationale saying it's too painful to be worth it, thinking about the other side of things, of whether you might have breast cancer. And obviously, it's worth it to have that information. When it comes to getting one, some folks feel like they have to have a referral. They have to have that doctor's note. They have to have some permission to get one.
Nope. So if you're about 40 or older, you don't need any kind of order. You can self-refer for a screening mammogram as long as it's been 365 days from your last one. We have ways to get underinsured and non-insured patients covered through multiple different grants that we have for screening mammography. So.
That's another, I'm so glad you said that, because a lot of times money is a barrier to that as well, because folks say, well, you know, I had one within the year, can I get another one underinsured? But you have ways of making sure people can still get that mammogram.
Yes, we do.
Okay, so we've busted all these myths. So
great, there we go.
So there you go, get in the car. Time for your mammogram. But before you do that, the Cancer Network, talk about that and the immense network that you have to support these folks.
It's really been wonderful bringing our resources together to try to work cohesively to optimize care for patients no matter where they live. So we have multiple different locations and ways that we can serve our patient population here in Grand Rapids. So it's nice from a collegial standpoint to have multiple opinions with our tumor boards. It's a very robust network, and it's really improving care for oncology.
And when you say improving care for oncology, that's important, especially when we're talking about cancers that the doctors talk to each other. So this network really is producing some more positive outcomes.
It's great. Yeah, we're really enjoying our collaboration collaboration together.
Absolutely, and you can too. If you want to learn more, if this is something that maybe you're hearing this going, you just busted a myth. I should probably go get that mammogram done. Well, get that scheduled today. TrinityHealthMichigan.org/mammography for more. Doctor, thank you so much for the time.
Hey, thanks for having me. I appreciate it.
Absolutely. We'll be right back.